Greetings from North Carolina. This is Dr. Fernessa Hall bringing you the fourth installation of COVID-19 Facts, Not Fear. When you know the facts, you can relax. So today's session is going to be on testing. It's not as cut and dry as you think, but before I get to that, I want to just recap the other three videos. The first video was on what the virus is, which is basically just a virus trying to survive, not out to get us. We talked about all of the social distancing and hand washing and sanitation measures having one goal, and that's keeping the virus from coming into contact with your eyes, nose, or mouth, your mucous membranes. That's how the virus gains entry into the body to infect us. The second video was about things we could do. Getting a good night's sleep, exercise, eating a healthy diet, specifically minimizing sugar and refined carbs, staying hydrated, and taking select vitamin supplementation that's supplemental to a good diet. That's vitamin A, 10 to 25,000 IUs 3 days a week. Vitamin C, 500 to 100 milligrams a day minimum. Vitamin D, 2,000 to 5,000 IUs a day, and zinc, 30 milligrams a day. The third video was really about reflecting on this time and how, while it has disrupted our lives tremendously, and many people have suffered horrible losses, that we can take this time and turn it inward and do some inner reflection, and maybe get back to the things that are really most important to us. And I also challenged people to take the 7-day mental diet, the little booklet by Emmett Fox, $4 on Amazon, and do the challenge, try it, and you might be surprised. So that brings us to today's episode, testing. It's very confusing. Hopefully this will help clarify some things. So we have 3 tests. Well, we have 4 tests actually. The gold standard, the best test is a virus culture. Nobody does that except research facilities. It's not used clinically, for regular patients. It's expensive, it takes a long time, and the people in the lab are potentially exposed to live virus, and that's kind of dangerous. So that test's off the table. Then we get to what's called PCR testing, and that is a test looking for the genetic material of the virus. And by finding the genetic material of this specific virus, we know that the virus is there. Samples are taken from nose or throat swabs or from sputum specimens. And this is the test you see when people drive up and they get swabbed. And it's it's probably the best and most commonly used diagnostic test to diagnose you actually having the virus. Recently, an antigen test was released. And this is also diagnostic, but it works in a different way. Each virus is in its own little capsule, let's just say, and there are areas sticking out from this capsule that are considered antigens, and this test looks for a specific or a combination of specific antigens for that particular virus. And while it is diagnostic, it is not considered quite as good as the PCR test, but it has value as well. Finally, which I think is probably the most controversial, is the antibody testing. People are very excited about this, and certainly it gives us some information, but that information, has to be tempered with reality. So a little basics about antibodies. In this, for this test, there are 2 antibodies that are tested for. The first is IgM. M is in Mary. IgM is the antibody that appears first, usually within 10 days of first symptom. It also disappears within a couple of weeks. IgG, as in giraffe, occurs later and it lingers and can be present in some cases for different viruses or infections for years. And it can confer immunity. Now, the big question is, does the presence of IgG antibodies for this virus give us immunity? And we think so. We don't know how long. We don't know if it's enough to prevent another infection later on in the year. So there are still a lot of questions about antibody testing in the sense of what does it tell us? Well, primarily it tells us that you were infected with the virus at some point in time. If the test is negative, it doesn't necessarily mean that you don't have the virus. So, from my research, it says that the best time to test for the antibodies is 20 days after the first symptom. Okay? If you test within 5 days of symptoms, you may not have had enough time to mount an antibody response. And so, how do you interpret that information? Well, you have to retest. What if you have no symptoms? What if you never had symptoms? Who can say that you weren't exposed 10 days ago and say you're one of those people who never had symptoms? It becomes a bit confusing to understand how to interpret the tests and the time frame. So it's really important to not get overly enthused about what the test can tell you, and what that means for what you can and can't do. So if you test positive for IgG antibodies, does that really mean that you can just go out into the world, no mask, no hand washing, and just do what you want? Well, maybe, but maybe not. And so you have to really work with a healthcare professional and understand why you're getting tested and what the best test is for what you're trying to find out. I would not go online and buy tests that you have sent to your house and you collect a specimen and send it off. Many of those tests are not very good. And understand that there are no FDA approved tests. All of the tests right now have been allowed by the FDA because we need testing. The best two antibody tests on the market are from Roche and Abbott, and those tests are available through both, one or both of them through Quest or LabCorp. There are others that are good, but again, you really need to work with a healthcare professional with regard to testing. Now, certainly if you were sick in February and you thought you had the flu and you're curious, I think IgG antibody testing is not unreasonable because then you can know whether or not you had it. That doesn't really change much of what you do because we still don't know if that protects you from having a COVID infection a second time. So I hope that was helpful. I'm sure it was somewhat confusing, but the moral of this story is that antibody testing isn't the ultimate answer. Two types of diagnostic tests, PCR and antigen testing, they are available. PCR testing is a bit better. So if you're going to get a diagnostic test, go ahead and get the PCR test. And in the meantime, help yourself. Keep yourself healthy. Follow the social distancing. Wear a mask. Don't just go hog wild because the states have lifted bans on things. Use your head. Come to your comfort level about how to behave out in public. And remember, it's not just about your health, it's about you potentially infecting other people. Remember, there are people out there who have the virus who don't have symptoms, and that's particularly dangerous. So I think until we have more information and more data and details about how this virus actually behaves, I think that we should err on the side of caution. So that's my final installation for COVID: Facts Not Fear. When you know the facts, you can relax. This is Dr. Fernessa Hall, and please reach out to me using the contact page at www.mdwellnesssolutions.com. That's SOUL. Thank you, and take care.